I'll be doing the family services report for the board meeting this way on video so that you can watch it and then bring questions to the board meeting. This will save us some time and give you some time to reflect. So, as always, we start any presentation at Jacob's Heart with the mission statement, of course. And the mission of Jacob's Heart is to improve the quality of life for children with cancer. And support their families in the challenges they face. And as you know, it is the board's responsibility to ensure that the organization is realizing its mission to the best of our ability. So I'm going to present to you today the family services and data trends for the second quarter of 2019. We conducted a census of the families that we currently have on service. These are the families that are in treatment, transitioning, off treatment, or recently bereaved. Right now, we are 79% of our families are enrolled in full scope Medi-Cal, which is the barometer that we use, the measurement that we use to determine their low income status. 45% qualify as high financial need. 37% are experiencing housing insecurity, many of this due to the high financial need that is a result from the ongoing treatment. And 45% of our families are subject to other major stressors in their life. We need to know about these so that we can help families holistically. Family service by county, we're going to look at the difference between this year at the same time. So the snapshot here for Q2 in 2019, we currently have, we'll look at Monterey County, 166 families of children with cancer, 11 non-cancer, and 177 total. You'll notice that all of the counties are pretty close this year to last year at this time, which gives us an indication that we're pretty closely able now to predict the number of families that we will have on service in our service area, as opposed to years before when we weren't really capturing the data, or we weren't really capturing all of the families who needed our service. So this gives us the opportunity to really plan our budget and our services better. So we're going to see a flattening in the trends of numbers of families on service. And we separate, we separate families. We do assessment of need at time of intake and then reassess regularly. And our high needs families, and they require a lot more hands-on attention, time, and they're just in a deeper crisis, either diagnostically, the prognosis, or financially, or a combination of that. So you'll see the trends are pretty similar again this year from last year, with a slight dip this year in the high needs families we serve, but not statistically significant. Direct support hours, the number of hours that our team is spending directly supporting families. These numbers that you see here are a combination of in treatment and bereaved hours. You'll see on your board report that these numbers are separated out. So this is all together. So you'll see that the trends, we're doing more service this year than last, but not a huge amount. Home and hospital visits. Hospital visits are down because of the implementation of our transportation program. The growth of our transportation program has required us to contract with a transportation company, which I'll talk about in a moment. So our family support specialists are not the ones driving the kids back and forth to the hospital as much, unless it's a real kind of crisis situation where the family needs the support. So those have gone down, which is fine. It helps our program to be more sustainable. Home visits are pretty consistent. Direct financial assistance. This number is something that we haven't budgeted very well in the past. We usually tend to under budget the need, not necessarily under budget the need, but under budget how much financial assistance we're going to be giving. It's a hard number to predict, of course, But given our guidelines, I think with the finance committee, we need to kind of reassess the amount of money that we're anticipating spending on direct financial assistance. We usually come in over budget on this number, but year to date, as you'll see from last year, we're up a bit. And the emergency financial assistance has gone down, which I think is a good thing because we're training our staff to do more financial planning and financial resilience and accessing outside resources and having fewer of those emergency situations where the family is just going to lose their house and we have to intervene. So we'll continue to look at that trend over time. Grocery bags continues to be a great program. Last year, we weren't taking families off grocery program. According to guidelines, we were using a little too much leeway there. I've reminded the staff that our job is to alleviate the stressors during treatment and for the year, 6 months to a year after treatment, that it's related, the grocery delivery, the financial assistance, all of those are related to the child's treatment and the stress on the family. After that, a year past that, then you're getting into another type of mission, which is alleviating hunger for families who are low income. And those, we refer families out earlier now to resources like the food bank and other resources for food. And so we're learning better about how to, when it's time to transition families. The mobile pantry to South Monterey County is going really well. And the Thursday pantry where the families come into the Jacobs Heart Center and get food and clothing and things like that is also going really well. So even though the grocery bags are down a bit, they're more directly serving the families that are in treatment, and they're also, families are actually accessing more food because of the pantry situation. It's going well. Transportation. So as you know, the provision for transportation changed by law in 2017. The California state legislature passed a law mandating that all Medi-Cal beneficiaries would have access to transportation provision. So as you know, we have been providing transportation on philanthropy for the past 20 some odd years. With this new provision, we decided that it was a better use of resources to partner with Medi-Cal, which is the Central California Alliance for Health in Monterey, Santa Cruz counties, that we would partner with them and become a reimbursable transportation program from Medi-Cal. And then that would save us the money that we were spending. So that is all going very well. It's not been without hiccups. Qualifying, we've had to upgrade our services. As I mentioned earlier, we are contracting now with Hearts and Hands, which is a medical transportation company. Their vans are co-branded with ours. Our families are connecting with their drivers. We're helping their drivers learn the nuances of driving children, and they are the experts in medical transportation. It's been a great collaboration. And we are being reimbursed now by the Alliance. We're currently working on a direct contract with the Alliance, but to date, our revenue on transportation has been $18,917, so almost $19,000 in revenue from the provision of transportation. So what we decided to do, if you'll recall, is to move some of that money into gas cards so that we would use that revenue to boost a very large need. So you'll see from last year, this year to date, we've distributed $8,725 in gas cards year to date this year, and we were at close to $1,000 last year. So that's a big jump. And this is actually in addition to the direct financial assistance program that we have. So I'm really proud of this. So we'll be talking more about this as we move forward with our partnerships. Results from family surveys. We don't like to give families a lot of surveys, but we do a short surveys just to assess, just let us know how we're doing so we can improve, and also for grant reporting. So this was a survey that was recently that was done on we were looking at communication, just a few questions, how quickly we respond to their concerns, 4.95 out of 5, which is really good. Our staff acknowledges and are sensitive to feelings and emotions. Again, 4.95 out of 5, and we got a perfect score on how we provide information in a way that's easy to understand. So much of what we do is really helping families understand what's going on. So we're doing really well with those things. Camp was amazing this year. I'm going to send you a link with this to our most recent camp video, which will give you a real good snapshot. So I'm not going to go into too much detail about camp, but watch the video before the board meeting. It's not been published yet, but it rained cats and dogs this year at camp, which proved to us that we can pull off a great camp. Everybody can have a great time in the rain. One of the kids said, "Oh, I hope it rains next year." And we said, "No, we really don't hope it rains next year." But it just shows that they still had a really good time. And one of the kids, I hope I've shared this with you. I'll attach it to the email, is that he said that camp was better than Disneyland. And I know that just made Darcy's day, all of us. So ongoing family events, that's the other piece of the Maslow's hierarchy about community and connection. These are where the love happens. We have our wellness series. We went on a bike ride, a collaboration with the Treehouse Project, the Cancer Research Initiative at UCSC. They all got together with our kids and us to do a bike ride. Great stuff. We went on a hike in Nicene Marks. They learned about the resilience of redwood trees, and we talked about the resilience it takes to get through cancer. They learned so much and had such a great time. We're doing yoga, essential oils, Art from the Heart's going great. We're doing the parent support groups concurrently with Art from the Heart, and the families are connecting there. We had 69 attendees at the last Art from the Heart, which is great. Teen group, Mariella's just rocking it, as you guys know, with the teen group. Just recently, just highlighting some recent things. They just went to the boardwalk, but that will be in the next quarter report. But they did a candle making activity, and they went bowling, and so they do some fun things, and they do some real bonding group things, and then Mariella works with them one-on-one on resilience, and we're looking at them, the post-traumatic growth in them. So that's going really well. Parent support groups are good, especially the bereaved Spanish-speaking group. I'm so proud of that, about that group. These families have really connected, and that really is a result from the connections that they made last year at the Forever Loved retreat. And so that group has really coalesced, and they've developed relationships outside of the group, which is so essential. So we're really proud of that. We're hoping that that will catch hold with the English-speaking groups, and we're trying to learn why that group is just really working so well. I know it has to do with Forever Love, but we're looking at how we can kind of bring some of what we learned from that to the English-speaking group, so we can increase the attendance in that group as well. But the ongoing parent support groups in treatment are also going well. Families just really appreciate it, even if it's just one or two families at a time, that they get a chance to talk with one another in between our overall family events. We got 5 new referrals this quarter. All of them are from Monterey County. And the good thing is we're getting referrals at a more timely basis. With closing that gap in time between the time of diagnosis and the time they get connected with Jacob's Heart. We did not have any deaths this quarter, but we do have some children who are imminent. We're working, as you know, in building their access to hospice, end of life, nursing, and all that. So I'll lead into this right now. So proud of this. Thank you to the board members who came to this meeting. On June 17th, we brought Dr. David Sine, who runs the pediatric palliative care. He's the pediatric palliative care medical director for Valley Children's Hospital. He serves the whole Central Valley, a tough area, and he's also medical director for a couple of hospices. So he liaises between the hospital and the hospices, and they in the Central Valley have been very successful at invoking the concurrent care provision, which this is what this meeting was about. And I thought it would be impressive if you could take a look at the attendees. And this was really a meeting about the nuts and bolts for hospices to learn about the concurrent care provision. As you know, the waiver, the palliative care waiver that used to be in place, is no longer in place. It ended at the end of last year, 2018. So this provision of concurrent care, we're hoping, and we know from what David Sine is discovering, is actually much better. And I'll explain that in just a minute here. So concurrent care for children is a provision of the Affordable Care Act, which allows a family when a child with a life-threatening condition to access hospice care without having to invoke hospice and without having to give up on curing their child's disease or prolonging their child's life. So this is really a special provision, and I actually worked on this years ago to get it into the Affordable Care Act. We haven't had access to this in our area because prior to these last few weeks or months, we haven't had hospices in our area able or willing to take care of the children. Now they are, thanks to a lot of the initiative of Jacob's Heart. So now the Hospice of Santa Cruz County is implementing a concurrent care for children program, and with our support and with support from Dr. Sine and all the other people that attended that meeting, we're all kind of in this together to figure out a circle of care for these children. Again, to invoke concurrent care for children, they do not have to give up any treatment that they're currently receiving at the hospital. And that's not the case for adults. When adults, or when you're enrolling on hospice, adults have to choose to give up curing. And that's hard for adults. It's really hard for children, as you can well imagine. So we are learning from the experience of Dr. Sine and others around the country how the best way to do this. And we are really blessed to have Jacob's Heart as part of the circle of care. So for those of you that are super familiar with what hospices do, this is a graphic that I just love that Hospice of Santa Cruz County uses to describe their services. Now this was for adults, so we're redesigning this to include the additional services that we're going to be offering to the children, which would be Jacob's Heart services. Imagine our services integrated into this circle. So the family is at the center of care. We have the hospice physician who, under concurrent care, can work with the physicians at the hospital. We don't lose those connections. Nurse case manager, they have a social worker. That social worker will work with our social worker, spiritual counselors, hospice aides, hospice volunteers, music therapy. All of these hospice services will be available to our children under concurrent care. So Jacob's Heart is working closely with Hospice of Santa Cruz County and CCVNA to contract with them to provide the grief support, because as you know, we are experts. We have a great grief support program here at Jacob's Heart, and our expertise is in the loss of a child. So we can weave that in and support that. Our services like transportation, direct financial assistance, gas cards, grocery deliveries, family meetings, all of our both of our camps, all of those services that we're providing will undergird the services of the hospice, and we will coordinate all of that to create a circle of care. And I'm hopeful that this model that we are building will become a national model, and it's already on the docket for National Hospice and Palliative Care Organization to track this with us and look at ways that not only here in Santa Cruz, Monterey counties, we can do this, but also that we can use this model other places. And when we take Jacob's Heart other places, we're taking a model that's integrated with the services that are already covered by hospices through the concurrent care provision. So I'll look forward to questions from you guys and discussion at the board meeting. And I think we'll have a great board meeting. So bring your questions and don't forget to watch the camp video. And don't forget to read the stories from our Child of the Month. And bring your brain and your heart next Wednesday. Thanks, guys. Bye. Hmm.